Miss ปิยาพรเกิดชา Miss เบญจวรรณช่างปัด and Mr. ปัทวีนิมสกุล The topic is effect of vitamin D metabolic bone disease.
Good afternoon, everybody. Metabolic bone disease is an abnormality of bone. It's not infectious disease and it's not bone cancer. It's common found in older persons. Abnormality of minerals are important cause of bone disorder. There are two types. The first one is mineralization such as osteomalacia and rickets. The second is low and high bone mineral content. Vitamin D deficiency is the main factor of metabolic bone disease. It occurs in two ways. The first way from environmental, such as insufficient UV skin exposure and malabsorption of vitamin A, D, E, K. The second way from biochemistry is mean dietary lack of vitamin D. Vitamin D can prevent metabolic bone disease by 1. It will increase calcium absorption as small intestines. 2. It increases bone mineralization and maintain calcium balance in the body. Moreover, it also inhibits parathyroid hormone from prevent calcium loss from bone. The first research, a poll analysis of vitamin D dose requirements for fracture prevention. High dose vitamin D supplementation can prevent hip and any non-vertebral fracture in persons 65 years old or older. We collect data from control group of oral vitamin D supplement with or without calcium as compared with placebo group. Primary endpoint is the incidence of hip and any non-vertebral fracture. Primary aim is we can compare relative risk in actual vitamin D actual intake of vitamin D in treatment group and data from control group.
From primary analysis, primary comparison of actual intake, there is 30% reduction in the incidence of hip fracture at highest level in treat group as compared with control group. There is no reduce the risk of hip fracture at any actual intake level than 792 IU per day. So we have to treat vitamin D with more than 800 IU per day. It can decrease the risk of bone fracture. From the introduction, we know that vitamin D can prevent metabolic bone disease by increasing bone mineralization and maintain calcium balance in the body. In this experiment, to increase vitamin D intake, we give vitamin D 12 in younger and older adults. The metabolic bone disease is thought to have a bone fracture, in which people find hip fracture and non-vertebral fracture. This research used vitamin D to see increase of bone mineral density and reduce the risk of fracture. This graph reveals a patient used vitamin D. This graph reveals a patient used vitamin D amount of 400 to 1000 IU per day. Its bone mineral density increased in hip bone, femoral neck, or total body, and age affected treatment. For example, a patient 8 years old used 800 IU per day can increase bone mineral density than a patient 30 years old who use vitamin D 1000 IU per day. And we use vitamin D in modulation to reducing the risk of fracture. In the red, the receive use vitamin D 30,000 IU per year to 50,000 IU per year. We find it impossible to reducing the risk of fracture. Maybe it was the result of less vitamin D.
The researcher, in another research study, the researcher used 24 months to inject vitamin D in very level and control calcium 0.4%. Then, give shake 25 hydroxy vitamin D3 serum, found that 16 to 170 nanomole per liter, and radiographic finding metaphysis of distal femoral and shape periosteal of mid-shaft tibia. The researcher showed effect of vitamin D deficiency to abnormal bone. Conclusion: metabolic bone disease in human and animal have many causes. The main cause vitamin D deficiency. That they have received daily. However, the study about appropriate vitamin D concentration in limits and needs more studying. Thank you for attention.
Any questions for this group?
Good afternoon. My name is Shanita Mahalin. I have a simple question. What is the connection between vitamin D and the bone?
From the first question, it's about calcium. Vitamin D increase the intestinal calcium absorption collecting in the bone. Thank you.
Good afternoon. My name is Anita Dambaron. The metabolic bone disease that represented how many suffer that and non-suffer that.
From second question, we use radiography to confirm this disease. Bone opacity will decrease. Thank you for your question.